God bless you. Conducting this program, I'm directed to inform you that we should kindly apply one of the COVID-19 protocols, that is, we need to wear a face mask, please. As I have told you earlier, in our mix today, leading the press conference is the Honorable Commissioner of the State Ministry of Health, Alaji Ali Abubakar MC Amasanan Safi, who is unavoidably represented by the Permanent Secretary in the Ministry, Pharmacist Ali Muhammad Mekio Maladi. The next thing in the program is self-introduction.
To completely eradicate malaria, and the efforts are being recognized nationally and internationally. Now that brings us to partly why I'm standing. I'm supposed to provide a bit of details or information on the fever case management campaign. And it is a national fever case management campaign that is being portrayed all over the country, and it's been endorsed by NNEP and the National ECSS. So Zamfara State is one of those states that benefit from it. So you just quickly watch the video with your permission, sir. It's a under 1 minute video. Then my presentation is less than that. Then we follow up. Please play the video.
Zamfara State SMEP, together with the development partners, we have been working day and night under the supervision of the State Ministry of Health to make sure that we eliminate malaria in Zamfara State. And inshallah, with the kind of support we have by the State Ministry, Zamfara State SMEP will continue to work hard to eliminate malaria in Zamfara State. Once again, thank you very much.
That are here with us, the media and other stakeholders that are here with us. Assalamu alaikum. As we are aware today, we are here again to witness another commemoration of Malaria Day, which is set aside to showcase malaria interventions, achievements with regard to malaria in the states. As we are also aware that it was first started in 2008, it was the WHO that set this day aside to celebrate this day of malaria. So we welcome you all to this important gathering. As you are aware, we know the burden of malaria. We are still having it. It's coming down. We are still having issue of malaria because if you go to most of our clinics today, most of the attendance admissions are due to malaria, despite the fact that the incidence or the burden is coming down. So let's all play our part, because we all have what contributes to eliminate this malaria. We have passed the stage of control, now we're at stage of elimination. Then after this one, we'll go to the next stage, that is the eradication of malaria, which we hope, with the kind of support we are getting from the Ministry of Health, the donor agencies, partners, and all the stakeholders, including the media and traditional institutions, we fight this level of elimination to get to the level of eradication of this malaria. Thank you.
Permanent Secretary, Directors, Partner Sales President, Assalamu alaikum. On behalf of the WHO, I'd like to congratulate Zamfara State for having this very important occasion, which is meant to sensitize the population to know the burden of malaria, ways of prevention of malaria, and the consequences or complications that it can result. So far, throughout the week, activities have been going on in the community, market, roads, and health institutions which we have participated. Actually, WHO country office has estimated that WHO Afro region has estimated that last year in 2021 we have about 278 million cases of malaria, with about 600 deaths. Most of these cases occurred in Africa. More than 55% of these cases occurred in 4 countries, and Nigeria is number 1. So we need to do something to protect this, the body. Actually, progress has been made despite the challenges of COVID-19 and so many epidemic-prone diseases throughout the nation and the world at large. So it is very important that we have this opportunity to interact, the media and so on, so that we can go out in the community and disseminate. Thank you so much. You're all welcome. Thank you.
Thank you very much. A sound goodwill message from WHO. I will now invite representative of UNICEF to say their goodwill message. UNICEF, is there anybody? Okay. Breakthrough Action Nigeria.
President's Malaria Initiative Project for States. I would like to welcome you all to this elaborate day, which is the World Malaria Day. And so far, for us, the partners from the US government, we remain committed in supporting the Zamfara state government in achieving the national goal of having a malaria-free Nigeria. And so far, we have, as it is said, that the burden is still high, but we are happy to see that we have walked this journey with the Zamfara state government, and I will be happy to see that Zamfara state is a model, and it has been leading, and it has been showing best practices for the whole country to see that we are determined to eliminate malaria. So on behalf of the PMI's project and my PMI implementing partners, my brothers, Breakthrough Action, I would like to congratulate Zamfara State, and we will continue until we get to that promised land of having a malaria-free Nigeria. Thank you.
It was unfortunate when I heard that today is Malaria Day, and I wrote that we as a clinician, I have to come and give my good message. Actually, we know malaria has become endemic and is one of the cause of mortality, morbidity and mortality, especially among our children and pregnant women. I being a gynecology and obstetrician. This is actually a glad occasion for us to show the world that malaria is actually a high concern in Africa, particularly in Nigeria. Although I wanted to give just a good message, but I'll use this opportunity to kindly, especially our pregnant women. And I learned that in my institution, our SP has become difficult. We at the manager will have to purchase SP for free distribution to the pregnant women. But sincerely, we cannot continue forever. The support, wherever the support is, whatever to get it, or whatever it is, just we need the support. As an obstetrician, I know the damage that malaria can cause to pregnant women, especially the primary breastfeeder and also to the unborn baby. This, wherever the support is, anybody that had my work, provided you can contribute. Please, I want that support of the parameter and intermittent therapy to continue in my center, particularly.
Thank you, Dr. Aziz Lives.
Assalamu alaikum. So on behalf of the board and the management of the State Hospital Service Board, we wish to congratulate the ministry and the state for being able to be where we are, because we learned that Zamfara State, despite all the challenges we have, with the support of the partners that we have on ground, we are actually being held at the national level. So we urge you to continue to give all the necessary support that is required for us, and I want to believe all hands will be on deck to ensure that we reach the promised land. From our part as hospital board, we give you the assurance that we are going to give you all the necessary support that we require to succeed in this regard. Congratulations for these celebrations of World Malaria Day. Thank you.
PSN welcomes us all to this momentous occasion. We're taking a cue from all UC PMI partners here present in congratulating Zamfara State and its esteemed workforce in the giant strides that you've all made in the fight against malaria. We, with PSM, reiterate our commitment to joining you in getting to this eradication phase, DPPS. Is it eradication phase or elimination phase? Okay, we want to go to eradication phase. Yeah. So over the next couple of years and times ahead, our engagements will continue to be widened in this regard. Thank you very much.
May we appreciate you, please?
On behalf of Nigerian Red Cross Society, which is auxiliary to the government in the provision of health, disaster management, and social welfare services, I wish to congratulate ourselves for this giant effort, especially that we just at the climax of the World Malaria Day celebration, because we started on 25th. We started with a roadshow, phone-in program, and other activities. So I wish to congratulate all of us for this achievement. Red Cross just joined the fight in last year, and I am assure you that we will continue to be on this part, and we'll continue to do our best. As you know, our strength is our volunteers. We have a large network of volunteers that can work in able community. Thank you very much.
Ministry and other health officers here in the state. The program manager for malaria and team and other program manager here present. President Malaria Initiative Team, Breakthrough Action, Global Health Supply Chain, Procurement Supply Chain Management, World Health Organization, Red Cross, media crew, ladies and gentlemen, Assalamu alaikum wa rahmatullah. I'm standing here for my honorable commissioner who has traveled to Visa Hajj. We pray for Almighty Allah to bring him back home safely. Before I go to his speech, I think I need to make 2-3 comments as the permanent secretary. One, I sat down yesterday together with the SNEP team and the acting director of public health in my office, and I find out that we have made tremendous progress in terms of malaria elimination. This is what has been achieved because the effort made by the government and also the development partners. I may request the representative of the PMI to stand up, the Breakthrough Action Office to stand up, Global Health Supply Chain, PSM, Red Cross, and WHO. So, my dear colleagues, these are some of the representatives of the partners who have put in their resources, their energy, their commitment to take Zamfara to the level where we are now nationally and internationally have been recognized for our efforts. I want us to give them a very big round of applause for the support they are giving to the state. And on behalf of my honorable commissioner, we really appreciate that and we continue to find the president at the home for all your support and whatever you do to be able to not only eliminate but to eradicate malaria in the new future. Please extend our profound gratitude to your funders. We really appreciate your commitment. Thank you very much. Also, during the meeting, and he made the presentation of the issue of the sulfadoxine, pyrimethamine, struck out not only for the Zamfara state, but for the whole country. We, the Ministry of Health, have taken an immediate action to procure SP as is now available in our drug management agency. But our plan is to find out the way we are going to reduce the patient load in some of our secondary and tertiary health institutions. Because we know the national policies recommend the ANC to be conducted at the primary health department. So we are giving more concern to distribute this free SP to the primary health care facilities and some few selected general hospitals so that our client will be able to go there and access it free within a short possible period of time. Then the issue of vehicle for MSV. Whenever the team wants to go out, you let us know. We have a lot of vehicles, and it's not only meant for one particular vehicle. So before you have your own dedicated vehicle, whenever you want to go out, you can come and make an amendment. Now let me read the Honorable Commissioner for you. The Zamfara State Minister of Health wishes to commemorate 2022 World Malaria Day. The 25th of April is set aside annually for countries to showcase their successes in the fight against malaria. The aim of the ceremony is to create awareness about malaria and its devastating effect globally. World Malaria Day also provides an opportunity for government and the international community to intensify efforts for providing access of affordable and effective malaria intervention to all populations. In Zamfara State, malaria is one of the leading causes of outpatient department. In Zamfara State, malaria remains one of the leading causes of outpatient attendance in health facilities. Despite the challenge, government and strong partnership with the relevant stakeholders have resulted in dramatic progress against malaria in the past 15 years. The ministry has formed a strategic partnership with stakeholders that include the media, traditional and religious institutions, as well as donor agencies to reduce the state malaria burden. For instance, in the year 2020, the Zamfara State government, with support of the United States President Malaria Initiative (PMI), distributed 3.1 million insecticide net ITNs and administered seasonal malaria chemo prevention SMC medicine to over 1 million children under the age of 5, which is the first integrated malaria campaign in Nigeria. The annual seasonal malaria chemo prevention is now an annual campaign aims in preventing malaria for children under 5. The state and some partner in the state thanks to the President Malaria Initiative for that support. The effort is to ensure that all households in the state have access to complete protection of malaria. Similarly, PMI, Red Cross and WHO support the state fight against malaria in areas such as surveillance, procurement and distribution of malaria commodities, malaria data quality, prevention, case management, capacity building and social behavioral change. Despite the progress being made, we recognize the need for improvement, so I urge all concerned citizens to continue to cooperate with the State Ministry of Health, particularly State Malaria Elimination Program, as we will initiate the improvement, particularly the State Malaria Elimination Program, as we will initiative that improve our collective well-being. I want to thank the Zamfara State government for supporting malaria program in the state by providing enable environment, regular payment of the staff, also salaries, payment of seasonal malaria care prevention 2020, counterpart funding, and provision of SP for the pregnant mothers, among others. Similarly, may I take this opportunity to thank His Excellency the Executive Governor of Zamfara State, Dr. Bello Muhammad Matallam Maradon, Guardian Kasar Hausa, for being a role model in the fight against malaria. I would also like to thank the World Health Organization, United States President Malaria Initiative (PMI), and the Nigeria Red Cross for their partnership with the state towards the elimination of malaria. I would like to acknowledge the dedication and leadership of Zamfara State Malaria Elimination Program to the state malaria response and selfless sacrifice by the state ACSM core group in malaria advocacy. This year the theme is Advanced Equity, Build Resilience, and Malaria, with slogans every effort counts. I hope that team capture our new commitment to end malaria for good. Remember, every effort counts. Thank you.
Next, malaria situation in Zamfara. So, sir, in 2018, after the survey, Zamfara State, we were part of the state that has malaria prevalence of 36, as you can see. And this one is based on the percentage of children aged 6 to 59 months who tested positive for malaria by using microscope. So Zamfara State, on that survey, we have 36 prevalence of malaria in 2018. Next. This is the ownership of net that carried out during that survey. Percentage of household with at least one net. In Nigeria, we have 61%, while in Zamfara State, we have 78%. So this is contrary to the first slide I showed, where Zamfara State has prevalence of 36. Because usually, the more you have nets, is the more you sleep inside net, and the less malaria disease you have in the society. So if Zamfara State have 78 ownership of the net, so there may be an issue behind having higher prevalence in the survey. Next. This is net among children by that survey is percentage of children under 5 who slept in the net a night before the survey. So Zamfara, we have percentage of 56, which is also very good, and contrary to the first slide I showed. So on that regard, there was a lot of funding commitment from the both government and partners. So that resulted in progress in Zamfara State. So that 6% may be because of the behavior of the health worker and the citizen towards the malaria activity. We are over there. We were over there. We don't say malaria. That was the reason why we have higher prevalence. Not because there was no good intervention and there was no malaria activities in the state. Next. So this is the current situation of malaria in Zamfara State. Next. This is positivity rate versus microscopic testing. So this is one of our indicators, positivity rate, in which, according to national NNEP, that each state is supposed to do MRDT for the 80% of the patient presented with fever. So in Zamfara State, if you look at the blue is the fever cases tested with MRDT, which if you look at January 2021, we were about 75%, and we keep increasing until February, March this year, 2022, where Zamfara State has about 90%. So, this is one of the progress we are having, commitment of the state and our developing partners, especially by the behavior change activity that was introduced by the breakthrough action, I think, in 2021 in Zamfara State, where all our facility, we were trained on importance of MRGT, discourage them from microscopy. Now, the red one show fever cases that are tested positive with MRGT. So, Zamfara State, the national guideline is you test more and you have less positive cases. So that is where we are. So we are getting there, though we have about 70-75% on our positivity rate. The next one is fever tested by microscopy. If you look at it in 2021 January, sir, Zamfara State has less than 10% of microscopy testing. So this result is from NDHIS2, which is a dashboard everybody can log in if you have access, and you see it is there presently. So this one, 2000 is one of the best, because in 2021 January we have less than 10, but in February, March 2022 we have just 2% of microscopy testing, because we are discouraging using of microscopy in the primary health care center. That is according to National Malaria Elimination Program. And even in the secondary and tertiary hospital, it's only expert microscopies that are supposed to conduct. We have to pick you, even if you're a lab scientist, train you in Lagos for at least 2 weeks and certified by WHO for you to be able to identify malaria parasite using microscopy. There is no longer +1, +2, +2, it's not existent. You have to be trained. Next. So this is the proportion of clinically diagnosed malaria cases. You can see, sir, in just 1 year, Zamfara State has reduced the clinical diagnosis of malaria from 14.2 to December 4.3%. And I'm sure this one they did not attach the January from March 2020, from January to March 2022. So I'm sure if the January March came out, Zamfara State will have not less than just 2% or less of clinical malaria diagnosis in Zamfara State. So this proportion of confirmed or completed malaria treated with ACTs. So you can see the blue one is confirmed or completed malaria giving ACTs, while the red one is confirmed or complicated malaria that are tested with MRGT and they are positive. As you can see, usually here is for you to, every patient that treated tested positive should have ACT. So in Zamfara State, you can see in some places 100% are having ACT given, while in July we have higher ACT because we link that to the during high rain season, and we were doing SMC. We started SMC then, and we had about positive malaria during our SMC. The people that we diagnosed, about 18,000 children, there were fever cases. Out of almost 8,000 of them were positive of malaria. So this may lead to that decrease of confirmed or complicated malaria in July. Next. So sir, this is percentage of ANC first visit that received IPTP, and second visit and received IPT2. So this is where we had challenge, because it's not in Zamfara, in the whole country there is no SP in the whole country, because the development partners are now withdrawing from supplying SP to the government. So that was the reason why Zamfara State from 151%, we are coming down to 39.9%. Especially, but in February you can see we have a rise of the SP in both IP2 and PT2. So this was due to the effort that we have from LGA level. Some chairman LGA supported some LGAs with SP that they bought. So that was the reason why we have this increase. Next. So sir, this is the facilitators. What facilitated the progress of malaria program in Zamfara State? Number one, commitment from the state government. All the funds that were released, we have adequate release of funds during malaria activity right from 2020, where we have integrated airline SMC campaign, where the state government released huge amount of money for the malaria program. And also 2020 SMC also we have support from malaria, and currently we have another support for the SMC that we are going to conduct in 2020. Also, Saving 1 Million Lives supported us with a lot of programs in malaria, from capacity building, training, SMC and others. And presence of development partners supporting SMEP. And these are lesser facilitators that we have, because we have our partners, we have about 7 to 9 partners supporting malaria, which many of them are doing their best. And we are seeing, that's why we have seen the result we have seen for malaria elimination. Presence of DMA in the state, which we have some NGOs that are supported by partners, and we have some that are not supported. But the implementation of DRF, that is Drug Revolving Fund by DMA, we are able to capture other LGA that are not supported. So this make the malaria drugs and commodity available in every local government in Zamfara state. So complete SMEP dedicated and staffing. SMEP is one of the SMEP in the country that we have full staffing and full capacity capable staff. The presence of functional ACSM committee. Our ACSM committee is one of the best in Nigeria that help us to do resource mobilization, sensitization and awareness. Next. Challenges: lack of vehicle for monitoring and supporting supervision, inadequate use of data for decision making. Next. So finally, SMEP thank our development partners and the State Ministry of Health for providing enable environment and necessary support for the malaria program. Next. So zero malaria start with me. Thank you.
Thank you.